Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Premier Moe will have opening remarks, followed by a presentation from Dr. Shahab and time for questions.
Well, good afternoon, everyone. Thank you for joining us here this afternoon. I'll be very brief today as Dr. Shahab has some much more detailed information on a number of trends and our recent case numbers that he would like to present and explain. Right now, things in Saskatchewan continue to trend in the right direction, both the case numbers as well as the vaccines that we are receiving and administering. Maybe a bit more gradual in both directions than we would like to see, but they are nevertheless moving in the right direction. As of today, our 7-day average of new cases is down now to 182. That is the lowest since January the 3rd and down about 43% from the peak on January the 12th. However, still that is higher than I think any of us would like to see, but it is trending in the correct direction. So what we're all doing together in this province and have been doing for so long now is collectively it is working. But we need to keep doing it, and we need to keep doing it to protect ourselves and to protect those around us. What it does is it helps keep our case numbers low and manageable until such time that we can have that access to the vast majority of Saskatchewan people with our vaccines. Our vaccination program, I mentioned, is also moving in the correct direction, but again, a little bit more slowly than maybe we would like to see. That's thanks in large part to the great work of our healthcare professionals. Saskatchewan has the highest percentage of our vaccines administered. I believe we're just up over 100% again of our vaccines administered in the province. And we have the second highest rate of vaccines administered of any province in the nation. So thank you to our healthcare workers that are being so efficient and quick with making vaccines available to Saskatchewan people upon their receipt. On Tuesday, we released more details on the next phase of our vaccine plan, which is focused on vaccinating the general population prioritized by age, as well as a few clinically extremely vulnerable individuals and people in emergency shelters as well as group homes. I've heard over the course of the last while some concerns from a number of healthcare workers about not being part of the Phase 2 sequencing, and as you know, many healthcare workers are included in Phase 1, and our officials are now working on any revisions that may be necessary to potentially include some additional categories of healthcare workers in Phase 1. As we continue into Phase 2, I know there are some other groups who have come forward in the recent number of days to advocate that they should as well be vaccinated sooner. And I understand totally why they might feel that way. And if we had more vaccines available from the federal government, we would be able to look at getting everyone vaccinated a lot more quickly than we have thus far. But the reality of the situation is that we're dealing with what is a very scarce supply of vaccines in Saskatchewan and across Canada. So sequencing by age is the best way for us to vaccinate as many people as possible and to do so as quickly as possible, and to do so in a way that reduces the severe outcomes as much as we are able. The stark reality of the situation is that elderly people tend to have more serious outcomes from COVID-19. We've seen that in a presentation most recently on Tuesday. I believe there was a slide that showed that 88% of Saskatchewan fatalities were of people over the age of 60. That's 88% over the age of 60. And that is precisely why our priority is to sequence our vaccine rollout primarily by age. That will allow us to get to as many people as possible. That will allow us to get to those people as quickly as possible, and will allow us to reduce the serious outcomes from COVID-19 as much as possible. And to do so with what, as I said, thus far has been a very limited supply of vaccines. We heard again here just this morning from Major General Fortin as he confirmed potentially another reduction in the next Moderna delivery to Canada. I believe we're getting confirmation of that through the Ministry of Health as we speak, and it will looks like it will now be about 168,000 doses to Canada. That's down about 1/3 from the earlier commitment. And we're just, as I said, confirming how many of those doses Saskatchewan will ultimately receive. The federal government continues to say that Canada will receive 6 million doses by the end of March. That would mean about 180,000 people could be vaccinated in Saskatchewan or 180,000 doses in Saskatchewan, and another 20 million by the end of June, which would be the second quarter, which would be about 600,000 doses into Saskatchewan. This means that by the middle of March, we are anticipating to be up to close to 4,000 vaccinations per day, and by the middle of April, we would hopefully then be up to about 7,000 vaccinations per day. That is why we have a plan that is primarily focused on age to reduce negative outcomes of those that contract COVID, but also focused on capacity so that we can ensure that we are prepared to deliver the vaccines that the federal government has indicated they will be providing. So I am very hopeful that the federal government is correct and that our vaccine supply will increase in the weeks ahead. And when that happens, our health system in Saskatchewan will be ready to supply those vaccines and provide them to people as quickly as possible. Until then, we all have the same responsibility we have had for far too many weeks and months now. Let's keep following the public health orders and the guidelines that Dr. Shahab has provided for us to keep ourselves.
Thank you, Premier. So I'll just make a few opening comments and then go into the presentation. So again, our condolences to families and friends of people who have passed away, including the two who lost their lives to COVID-19 yesterday. While we are currently seeing reduced trends in the last few weeks, each loss of life is one too many. Before I present updated epi and modeling information, I do want to say that a declining trend is something that we need to continue to see, and we need to continue to stick to our best practices and not relax our measures right now, because we really need to see this declining trend over the next few weeks. And this is especially important because of variants of concern being detected, not just in Canada, but in Saskatchewan as well. The best protection against COVID and against transmission of variants are all the public health measures we are now practicing, like the Premier said, wearing a mask, maintaining physical distance, 2 meters, staying home as much as possible, and staying home even with mild symptoms and getting tested right away. COVID testing is available to all residents, and even people who think they may not have been at risk. If you have any symptoms, please do get tested, because sometimes COVID does transmit in surprising ways, and we can't always find where exposure happened. So testing is essential, especially if you have any concerns that you may have been exposed, if you have any symptoms. But even if you are in doubt, testing is a good way to see if you're clear of COVID, or if you need to isolate for 10 days and let your close contacts know as well. As we all prepare for Family Day weekend, away from work and school, please remember that, this is not the time to go traveling out of province or far from your home. We still can't visit friends and family indoors. Although the weather has been quite cold the last week, it may be better over the later part of the family weekend, Monday and the week ahead. So, you can go outdoors with your household, you can meet and greet others, keeping a safe distance. But, please abide by outdoor restrictions in place as well. And it's important not to get close, even outdoors, without a mask, or hand things back and forth, or share food or other items, even when outdoors. I think it's so important with our declining trend that we continue to see this for the next little while. And with this, I'll just maybe show a few slides on epi and modeling. And in spite of our declining trend, and the graph on the right shows that we had a bit of a decline over the holidays and then went up in the early part of January, but are declining now successfully. We are, our active cases still are on the higher side in Canada, but, coming down. We really need to maintain this trend. And similarly, our new cases, again, are on the higher side compared to other provinces, but again showing that same stepwise decline, and really need to maintain this downward trend. We have unfortunately seen hospitalizations both in ICU and hospital that again are slowly coming down now, and unfortunately have seen a high number of deaths over the last 2.5 months. If we look at our details by the 13 geographies, again, very positive numbers overall. Our daily case rate is 16 per 100,000. We really want to see this coming below 10. Our test positivity is coming down. It's still above 5%, but it's 7.7%. We need to see it coming down. I think all our efforts in Saskatchewan paying dividends, as we can see at a local geography. Some areas are coming down significantly. Daily case in some cases are below 10. Test positivity is in some cases, at 5 or around 5. But, some jurisdictions, north, far north, do still have high test positivity and high daily case rates. And again, northern leaders, public health, everyone is trying to minimize transmission, whether it's due to events over Christmas that seem to have an echo effect for many weeks, or other events that resulted in outbreaks. They are being managed successfully. Even in the north and far north, the trend is declining. Vaccinations are picking up. So all this bodes well for the future, but we do have to stay the course. Just a bit of comments about the variants of concern. Obviously, there's B117, which was first found in the UK. There's B1351, which was first found in South Africa. And there's the P1 variant, which was first identified in Brazil. All three have been identified in Canada, the UK more so than the B1351. But the P1 has also been identified. And so this is something that we need to continue to watch. It's a reason for reducing unnecessary travel outside of the province, maybe monitoring ourselves very closely whenever we travel anywhere, maybe thinking of staying as much as home as possible. If you have traveled out of the province, getting tested at the slightest concern and mentioning that you have traveled out of the province, even if not internationally. It's going to be so important to pick variants of concern and make sure that we try to avoid as much as possible community transmission. As of February 9th, 81 countries have seen B117, 42 countries have seen the 501Y strain first identified in South Africa, and 16 have seen the P1 variant. And we are still at 3 cases in Saskatchewan of the B117 only, all related to travel, all isolated successfully with no evidence of community transmission. But again, the public health laboratory is increasing screening and testing. They're at 3 to 6%. They need to go up a bit. Maybe start in-house testing as well, in-house genotyping as well. But this is something we absolutely need to continue to watch closely. And, I think we have seen in the UK that even though they came out of a very strict lockdown in November, the variant of concern has started transmitting even while they were in lockdown, and picked up pace over December, over the holidays, and they had to go into a very strict lockdown in January, including school closures. And this is not a place which any jurisdiction in Canada wants to go, and we need to do everything we are doing now, following public health measures, to avoid as much as we can variants of concern getting established, and at the same time see a higher uptake of vaccine programs, because I think that is going to be something that will be essential. And this is recent modeling data by the modeling team. The black line is really showing new cases, hospitalization, ICU admissions. The actual case numbers tracking, the solid red lines are showing where we could be with current measures, and the dotted lines above and below are the kind of confidence limits. So again, we are on a slow downward trend. Recently, actually, it's accelerating better than what the modeling is shown. Our effective reproductive number has been under 1 for a few days. So I think everything is looking very positive, but we can't let our guard down. We really have to stay the course for the next few weeks and really see our numbers coming well below 200, below that 120 if possible, because that really gives us that safety margin if variants of concern were to come again to Saskatchewan. And of course, modeling from other jurisdictions like the US, UK show that even without vaccination, if you put public health measures in place, you can, with great effort, control transmission of variants of concern. But of course, if once you have vaccine programs in place, then that makes it much easier as well. So this just shows that with vaccination programs, the control of all COVID transmission is easier. And if variants of concern were to come once a larger proportion of the population is vaccinated, towards the end of spring, early summer, we are better placed to face any COVID strains, even the current variants of concern. So all this means is that we really have to stay the course for the next few weeks, see our numbers come down, see our vaccinated population numbers come up, and that will really hopefully see us through this pandemic. In terms of our contacts, they have been going up a bit, so that we just need to watch our close contacts, both at work, when we're out and about, keep them as low as possible. Again, utilize all the options businesses have given us. You can go safely if you are comfortable to a restaurant, but you can also order takeout. Many local businesses offer curbside pickup, utilizing that more, going at times when there's less crowding, going less frequently, making a list and going in a very systematic way if you need to buy something. All that reduces crowding, reduces overall transmission, and lets so many things remain open while continuing to maintain a downward trend. But we all need to, be very meticulous about all these measures. Mask use when we visit any business, maintaining 2-meter distance, hand hygiene, not going out if you're unwell. And again, our hospitalization numbers, again, we have seen hospitalization every age group as well as ICU admissions, but certainly they pick up in older age groups, and so do, unfortunately, deaths. This graph just shows that our total cases, those are the orange bars, obviously are higher in the young adult age group. Hospitalization, even in young adults, COVID is not always a trivial illness. You can have hospitalizations. That's the middle bar, even in young adults we've seen. In every age group except the 5 to 15, we have seen hospitalizations and even ICU admissions. And then deaths, we've seen some in younger adults, especially those with underlying health conditions, but then certainly, age 50, 55, deaths pick up, unfortunately, with every 5-year age group, and especially after age 60. And this again just shows that why an age-based program, vaccination program, is so essential to reduce severe outcomes, especially deaths, ICU admissions, and hospitalizations. But obviously, once 60 and over are covered off, it'll be important for all of us to step forward and get vaccinated so that we can finally look at coming out of this pandemic. And again, our testing numbers have been coming down a bit, but our test positivity rate is also coming down. So, but we still need to keep our test numbers up. The last thing we need is transmission continuing for a week or two, more and more people getting infected, and suddenly we see a sudden increase in hospitalizations in any part of the province. So testing if you're symptomatic, testing if you're concerned, helps you to isolate if you're COVID positive, helps your contacts to quarantine if they're COVID positive, and breaks the chain of transmission. So we can't let our eyes off our testing rates. They are good. They've been coming down a bit in some regions where there's low numbers, but this is something we need to maintain throughout the next weeks and months. And so finally, like the Premier said, we all know the drill. We all need to up our mask game. Use the best mask you have. 3-layer if you have one. If you want to get a mask, get the best mask that fits you well, 3-layer with a polypropylene filter. If you're using a disposable mask, get the best mask you have. There's lots of information now on the website about how to improve your fit, how to, if you're wearing it the whole day, how to use something at the back, a clip or something, so that, you reduce pressure on behind your ears. There are all kinds of hacks that work for different people. Different hacks work for different people. But we really need to make sure that we are really good with our mask use. Our children are using masks well and appropriately, which they have shown they have been using in schools, and that's why schools have been doing so well. Physical distancing, many jurisdictions have gone back to 2 meters after going down to 1 meter. We always remained at 2 meters. The one thing we have in Saskatchewan is space, both indoors and outdoors at our public places, making full use of that space to maintain that physical distance at retail locations, other businesses, other public places. Again, reducing our close contacts as much as possible, minimizing non-essential travel within the province and to other provinces as much as possible. So important to prevent bringing back variants of concern, especially the family long weekend, family day long weekend, and school break. Staying close to home is going to be important. If you are meeting with friends and family, obviously we can only meet outdoors with people outside of our household with a few exceptions. But even there, maintaining that 2 meter distance is going to be important. And I think with that, hopefully over the next few weeks, we can continue to maintain this downward trend, and with increased vaccination rates, start coming out of this. And finally, I'll close by saying that, I already mentioned this, that we have a very limited supply of vaccine. There's some indication that it may pick up in March, April. There may be other vaccines that may come online later in the year. But that is going to be our way out. And right now, the vaccines we are hoping to receive March, April, May, we really have to emphasize people at highest risk of death. So that was initially long-term care residents. We haven't been able to cover everyone even there yet throughout the province, but then 80 and over, and then 70 and over, and 60 and over. That is going to be critical over the next few weeks and months. And we are similar to other provinces. We're all in this together, and we all have the same goal of reducing the most severe outcomes out of COVID initially, but then over the summer, all of us getting vaccinated so that we can end this pandemic. And then, I think I just maybe close by saying that, we obviously, like the Premier said, many people have been working at the front lines, healthcare, other essential services, retail, police, and we need to recognize their contributions. Working at the front line, sometimes even by using the best practices, still getting exposed, bringing COVID back to their families. We need to recognize their sacrifice at being at work throughout this pandemic, not having the luxury of being at home. And obviously, once vaccination is available for everyone based on age, it is essential for all of us to step forward. But, maintaining these precautions throughout, all these measures at work while we are out and about are going to be essential over the next weeks and months. Thank you.
Thank you, Premier Moe and Dr. Shahab. We will now take questions, and we'll start on the line. Operator?
We have Laura Sharpatelli with CBC.
Hi there. Can you hear me?
We can hear you.
Okay, great. Yes, thank you so much for your time. We've had some people contact us about concerns about queue jumping for the vaccine rollout plan. I'm wondering, will there be health cards required for proof of age at public clinics? Will administrators be required to turn unqualified people away? What kind of plans are there for any consequences should queue jumping occur?
That's a really important point. And, for the most part, people, as long as people have information about when they expect to get vaccinated, which was in the plan released on Tuesday, I think people are, we've seen throughout Saskatchewan, even when we had the pandemic in 2009, people do get to know when it's their turn and come at the right time. I think we had one of the most successful vaccination programs in 2009 during the H1N1 pandemic. But absolutely, age is the easiest way to sequence. Everyone has some, health card and other ID that shows their age, and that is the easiest. If you get into too many variables, it becomes very hard to figure out if you should go now or later. And for people, running immunization clinics to figure out, in many cases, people are well-intentioned, but if you make things complicated, it's really hard to move things quickly. And if we are going to get the high volumes of vaccine we've been promised in March and April, age-based approach is going to be the way to go to get lots of people in quickly into clinics so that everyone knows what their age is and when they're eligible to go. And we have to also remember that, we should not worry that if you are 70 and older and you couldn't go when it was your turn, once 60 and older eligible, if you're 70 and older, you can always go once younger age groups become eligible. So once eligible, always eligible. But I think that will be the quickest way, using an age-based approach, to get the high numbers which we hope to vaccinate over March, April, and onwards.
I would just add to that, and I would just ask, Saskatchewan people to not entertain the thought of jumping ahead of the queue when it isn't their turn, and it's for two reasons. We all want access to these vaccines as quickly as possible, but there's two reasons that I would ask Saskatchewan people to not do so. When you are jumping the queue to get a vaccine before, that means that vaccine will not be available to someone that will be older than you, and ultimately would be at risk of much more severe health outcomes than you might be. And we're better than that in this province. We need to prioritize those that are at risk of having the most severe outcomes from COVID-19 and ensure that we make what has been to this point a very scarce supply of vaccines available to them as quickly as possible. And that is what we are doing. The second reason I would give it and to ask people not to QB jump is, if we do receive the vaccines that the federal government is committing that we will receive, the 6 million in the first quarter, 20 million in the second quarter, we're already just about halfway through our first quarter. It looks like we're probably going to start receiving some substantial numbers sometime in the middle of March. We're going to receive, I think, over 3 million doses of vaccines essentially in the last couple of weeks of March. The last couple of weeks of the first quarter, we'll receive about 50% of our allocation. We're preparing for that at the Saskatchewan Health Authority. That will go into our phase 1 dispersal, and then that's when we will achieve the 3,000 doses a day. We will then double that if we have the vaccines available as we get into the first month of the second quarter, or April, and then start to make our way through what's remaining in the phase 1 and then work our way into the phase 2. As those larger numbers of vaccines arise and we get into 7,000-8,000 doses being administered a day, we will work our way through this relatively quickly in the province over the course of a number of months, and I'm confident that you will have access to a vaccine should we get that supply throughout the spring, summer, into the later summer. And I would just ask you not to Q jump. That is taking a vaccine away from someone that quite likely might have some more disastrous outcomes than you may have. And then once we get going with this, we are going to make our way through it quite quickly, and everyone will get their opportunity to have access to a vaccine. That's how we traditionally treat one another here in Saskatchewan, and I would ask that Saskatchewan people continue to act accordingly.
Do you have a follow-up, Laura?
Yes, I do. Thank you so much for that answer. So Manitoba has announced its own purchase of COVID-19 doses. Has Saskatchewan procured a vaccine separate from Ottawa? If so, what are the details? And if not, why not?
Oh, sure. Yeah, no, we actually had a conversation with both Premier Kenney and Premier Pallister. I did last week on this specific company. I believe Providence is where Manitoba has procured some vaccines, and it's not off the table for Saskatchewan as well to engage on that option, understanding that we have already invested in domestic vaccine production in Saskatoon, in Vito Intervac, where we invested alongside the federal government in the construction of their production facility. It was a request that we had in front of the federal government a few years ago, but one that thankfully they did deliver on this past spring, and that production facility is under construction as we speak and being constructed as quickly as possible. I would also note that Vito Intervac has entered into their human trials here, I believe, just this past week, and are moving forward to having their own vaccine that would come on the market at some time, likely early in the new year, possibly a similar time as to what Providence is. And they have a couple of asks in front of the federal government, one to fund their phase 3 portion of their vaccine development, which we would expect the federal government to approve, as they did with the NRC application from Montreal. And they also have an application in front of the federal government with respect to becoming Canada's Centre of Pandemic Research, of which we feel is a very, very valid request. One, again, funding that was provided to the NRC in Montreal, and a lesser amount of funding relatively would be provided to Vito Intervac, which would be a very large step forward before the federal government to have this domestic production capacity, as well as domestic research, vaccine research capacity, and to have this Centre of Pandemic Research right here in Canada that can take any future vaccines that we may need, right from the development stage through the production stage, and take care of Canadians with domestic supply. So we are, the Providence purchase, such as Manitoba has looked at, is not off the table for Saskatchewan. We continue to look at it. understanding that we've already made significant investments in the Vito Intervac facility in Saskatoon as they work their way through to having a vaccine that would be available for Canadians and others abroad as well.
We'll take our next question in the room. Steph?
Yeah. Mr. Premier, you mentioned that officials are going to be looking at ways to include more categories of healthcare workers. Can you commit, just to be super clear for healthcare workers out there, can you commit that more healthcare workers will have access to the vaccine than currently do right now?
I can commit to what the ministry, to communicating what the Ministry of Health will come for. I can't commit as to whether it would be more healthcares that will be included, but listen, what we did last week was come forward with our phase 2 mass vaccination plan for Saskatchewan, and that phase is really our ability to prioritize people by age, understanding that age is the largest determining factor in negative outcomes should you contact COVID, but a plan that still allows us to get up to the numbers that we think we will need to hit in order to ensure that we can deliver the vaccines that we are expecting to receive and are told that we will receive. We have our phase 1 that we're into now, and we must remember that we're a long ways from finishing our phase 1 vaccination, maybe 10 to 12% of the way through. It includes our long-term care residents. It includes people that are over 70 years of age, and a number of healthcare workers that, would be, you said front-facing to COVID patients in the healthcare system, I think was the term that Dr. Shahab had used. What we've asked the Ministry of Health to have another reevaluation of, is there other groups of folks in the healthcare sector that would be at high risk of coming in constant contact with COVID patients? Is there other groups that maybe we could include and pull forward into that phase 1 vaccine access? But in saying that, it isn't going to be all of the groups across the healthcare sector. There are going to be a number of folks in the healthcare sector that are going to be under the mass vaccination age priority, but we want to have another evaluation as to, have we ensured, all of those that should have access to a vaccine here very early. We want to provide that access. That being said, again, this comes down to everybody does want to, have their vaccine and have it as quickly as possible. Ultimately, we just don't have enough vaccines to make that available to everybody. Dr. Shahab, do you have anything to add to that? You've been talking with your colleagues across the province and across the nation as well.
So obviously, we have, groups of people looking at this within the province, and then colleagues looking at this from a variety of perspectives in every province. And so, there's a risk of severe outcomes, which is age-based. Then there's risk of exposure, which applies to all essential workers, including healthcare workers, but other essential workers. And then how to mitigate that. For example, healthcare workers have been very successful using personal protective equipment. And then there's the risk of transmission to those most vulnerable. So long-term care staff may not be at risk of exposure, but they can certainly, if and they were to inadvertently expose long-term care residents, at risk of exposing people at high risk. So all those aspects are important, but right now, the primary focus is reducing hospitalization and death. And then, of course, healthcare workers are a critical group that have already been offered vaccination in limited numbers, who are working primarily in areas where they have COVID patients, ICU, ER, COVID testing centers. But obviously, as we move forward, other clinical areas could be considered, and that's part of the NACI framework. Other essential workers, again, they need to minimize the risk of exposure, and certainly look at getting vaccinated as they become eligible based on the age-based cohorts, which again should move quickly down the age groups once vaccine supplies are sufficient. And then, of course, there are other high-risk settings like congregate living settings. I think we need to look very closely at how we can minimize transmission risk there. We already are looking at congregate living settings for the elderly, like long-term care and personal care homes, but we need to keep an eye on other settings as well. And then, of course, the clinically most vulnerable, who may be younger but are highly vulnerable because of chemotherapy, radiotherapy. That's also something that has to be considered. But at the end of the day, with the supplies we have, I think the biggest impact is moving down based on age-based criteria. And obviously, it's not an easy decision. But, where are you getting the most impact out of your vaccine right now with constrained supplies? It really is based on age. And that's where, it's 80 plus and moving down age group 70 plus and 60 plus. But obviously, as vaccine supplies increase, all these other considerations will have to be looked at very closely and to optimize vaccine uptake to reduce primarily initially over the spring and early part of the summer to reduce the worst outcomes, death, and then hospitalizations. But then over the spring and summer to also reduce even mild illness, because that then will get us out of this pandemic.
Follow up?
Why even bother trying to include more healthcare workers in the plan then right now? Like, do you, Mr. Premier, that your government maybe made a bit of an oversight or a bit of a mistake in just kind of blanket saying, no, we're not going to do any more than those who are just seeing COVID patients, we're going to focus on age? Like, was this a bit of a mistake to not try and find a way to get more healthcare workers in there off the get-go?
No, I think what we're doing is we've heard from many healthcare workers over. I'm sure Dr. Shahab has likely heard from a few as well over the course of the last few days. And we want to ensure that we have the integrity of our healthcare system intact, and our healthcare system and the individuals within it have you've been working very hard for a number of months now, and I understand just how hard they have been working under some pretty unprecedented circumstances as we work through battling together this global pandemic in COVID-19. But we do need to preserve the integrity of that system, and so with phase one as it came out originally, it had a number of healthcare workers prioritized in that. In fact, the first two individuals in the province that did receive the vaccine were healthcare workers, and it was on the evening news when that occurred. And I think that signifies the priority that this province has put on our folks that are on the front lines in healthcare. But we do need to, as Dr. Shahab said, balance the very scarce number of vaccines that we have with there is, yes, risk of exposure, and that isn't just in healthcare. We have other groups that have approached us as well. The Police Association, for example, the teachers have approached us as well. Balance that with the risk of detrimental outcomes from COVID, which is age is the number one factor in a bad outcome should you contact COVID, with the exception of some of those that have some very serious medical ailments, which we have included as well in these early stages. And balance all of that with the capacity of the vaccines that we ultimately have to get out by the middle of March, about 4,000 a day, and by the middle of April, we're looking closer to about 7,000 a day. So we're trying to balance what we can, preserve the integrity of our healthcare system, and ensure that we are getting as many vaccines out to people as quickly as we possibly can. This is no easy task. As we go through this, we're going to continue to change and adapt to ensure that we are, doing the best by the people that we ultimately serve here in the province. So the Ministry of Health is having a look to ensure that the segments of the healthcare and the folks in our healthcare system that we have in phase one. Are there others that should be pulled forward into that phase one? There may or may not, and we'll wait to see what they come back with their advice.
We'll take our next question on the line. Operator?
We have Lisa Schick with CJME.
Hi. Premier Mo, what is your opinion of Health Canada allowing Pfizer to relabel their vials to show they have 6 doses instead of 5? Seeing as we're hearing the health authority is only able to get that 6th dose about 20% of the time right now until they get those low dead space syringes. Do you have concerns about that change?
Yeah, I was vocal about those concerns as well, and I believe we're able to get the 6th dose out of the Pfizer bottles about half the time, if I'm not mistaken, in there, Dr. Shaw.
A bit more.
A bit more than half of the time. So, I understand with some different equipment such as syringes that should increase, but we must also understand that, these are humans that are out trying to get every drop out of these vaccine bottles as they possibly can, and my hat's off to the folks that have been doing it thus far. We're little bit up over 100% of our delivery rate here today. And I thank them for, their very efficient efforts in getting there. But we have not been able to get all 6 doses out of each and every vial, and I'm concerned that we will not get all 6 doses out of each and every vial. I had voiced my concern to the Prime Minister and to media previously that they should consider keeping it at 5 doses, quite honestly, because it is it provides more access to more doses for Canadians. Here's why. As they change from 5 to 6 doses, Canada's vial shipments will drop. We will get less vials in Saskatchewan and across Canada, with the expectation that we will get 6 doses out of each vial. It isn't that way in other areas of the world. In the U.S., when they changed from 5 doses to 6 doses on their vial, they continued to receive the same number of vials, thereby increasing the doses that they were making available to Americans. So, that is problematic. And I had voiced that concern with the CEO of Pfizer Canada when I had talked to him. But I understand that Health Canada has now made this change, and we await the delivery of the needles. My understanding is the Health Canada has also, or the federal government has procured, I believe, 70-some million needles or syringes that they will make available to the provinces. We're expecting delivery of those later this week or early next week. And we will do our best to extract every dose of vaccine out of those vials that we possibly can. But this is an error and likely will result in less doses for Canadians in the first quarter.
Do you have a follow-up, Lisa?
I guess it seems like there are still many details in the plan that have to be worked out, both in the first phase that's ongoing and in the second phase. For example, online booking for vaccination appointments, I don't think will be online until next month. Aren't these things that should have been figured out a little earlier? It seems kind of late in the game to still be deciding on some of these details.
Yeah, I think we can certainly ask the Saskatchewan Health Authority to provide regular updates, but at the end of the day, a simple sequencing process that will announce that, okay, in this part of Saskatchewan, everyone this age and up is eligible for vaccine. And the fact that there will be many avenues to get vaccinated, like Mr. Merriman announced on Tuesday, drive-through clinics, mass vaccination clinics, many other sites, I think will simplify the process, whether it's through an online booking or through just going up to a clinic that's been announced. There will be various options to get vaccinated. It should be easy to know where you stand in terms of your eligibility. And so I think that should be the principles, that it should be easy to get into a vaccination clinic with clear instructions. When are the clinics happening? Where are they happening? How can you go there? What do you need to have when you go there? And do you need to make a booking, a prior appointment, or is it more of a drive-through? I think we'll request SHA to keep providing that information. But as the clinics expand in numbers, I think it really should be easy to get in and get vaccinated, in my view.
We'll take our next question in the room. Stephanie?
So Premier Moe, what are your thoughts on the NDP saying that the reason people in their 60s will be receiving the vaccine before healthcare workers is because of politics and votes?
No, they're wrong. As simply isn't it? No, most certainly the people in their 60s have poor outcomes if they should contact COVID. The data that we have here, for example, people in their 60 to 79 since February the 9th, at February the 9th, 76 of those have been hospitalized. It's the largest category, according to Dr. Shahab's graph here, of any other age range. We most certainly are making this vaccine available on a priority basis, ensuring that those healthcare professionals that are at high risk of coming in repeated contact with COVID patients do have access to that vaccine, and they've been a priority in phase 1. We're doing a reevaluation of those segments as we speak. But ultimately, at the end of the day, our hospitalizations, as you look at the graph, are the fatalities that we have are largely in the sector that is 60 years and older. So that is a statement that I quite frankly wish the NDP wouldn't have made, and I think they should retract it.
Follow up?
Yes. How much rapid testing capacity has the province received from the federal government, and how much has been used, and how does the province plan to roll out rapid tests?
Right. So we have, Dr. Shahab, you may have a comment on this as well. And the rapid screening devices that we have, they don't identify a positive case for certain, but they do identify negative cases. And so they're a valuable tool. And we have received, thankfully, many hundreds of thousands of these Abbott tests that we are now dispersing to various areas. And they should have been dispersed sooner, and we do need to do better here in Saskatchewan. We've asked the Saskatchewan Health Authority to ensure that these are being dispersed to, a number of priority areas in the province, starting with, but not ending with, as we are still having conversations around other additional areas where these rapid screening devices could arrive. But we have had them in long-term care facilities for some period of time now. They are being dispersed now to correctional facilities as well as a screening device for the staff and inmates in our correctional facilities. They are being dispersed to schools as well for students and for all the staff in our schools, as well as we've been in contact with some Indigenous communities that may want access to some of these the rapid tests that we do have. And we are having some conversations about additional areas of our community where we might be able to provide these tests so that they can be utilized in the next number of weeks. So they are in fairness, we should have had those deployed sooner than today. But a number of them are being deployed, and there's some conversations with respect to any remaining inventory that we might have as to where that could be deployed to be effective in screening out some of the negative test results that are out there.
We'll take our next question from the line. Operator?
We have Gabriela Panza Beltrandi with Global.
Hi, yes. Just from my understanding, the Southwest and South Central zones still haven't received vaccines to the state. So I'm just wondering if there are plans for the Southwest and South Central zones to receive the vaccine, whether they're included in the plan already announced, or we're just looking for some details on that.
Well, they were included in a plan that has come and went, and due to the repeated lack of access that we've had with vaccines, we had to utilize those vaccines for second doses in areas of the province, as we were going to be beyond what was the recommended time frame for second doses. So the lack of vaccine access in the first month and a half or 2 months of our vaccine program has had consequences. And one of those consequences is that we have areas of this province that have not had access to even their first dose, although they were planned to have that by now. But as I said, we had to utilize those doses as second doses because we had our shipments cut back for the last 3 to 4 weeks here now. And now we're hearing today, as I said, we're just getting confirmation, potentially another cutback on our Moderna shipment that is coming. That is going to leave us with, if we are going to achieve our 6 million vaccines in the first quarter, 20 million in the second quarter, a substantial amount of those vaccines, over half of them, are going to arrive in likely the last couple of weeks of the first quarter. And that's what we're preparing for with our public health and Saskatchewan Health Authority, is to ramp up to about 3,000 doses a day by the middle of March, and likely about 7,000 doses a day sometime in April, so that we can ensure that if we do receive those numbers of vaccines, that we're able to make them available to Saskatchewan people as soon as possible on the priority basis. We'll still be in phase 1 at that point in time, but very hopefully at some point be into phase 2 and providing doses to the broader masses of the people in the province.
Do you have a follow-up, Gabriela?
Yeah, just so following up on that, then is there a plan to make areas like the Southwest or South Central that missed out on the vaccine because of a lack of having it? Is there a plan to prioritize those areas so that they can catch up, or when would they, I guess, be in the schedule of being able to access vaccination?
Yeah, Dr. Shahab, you might have a little more detail on this, but I would say the priority right now with the vaccines that we have is to get them into our long-term care homes, and the staff in those homes, the residents, as well as to provide them to our select healthcare workers that are already qualified for phase 1. And as I said, we're reevaluating exactly which segments those are, and people that are over 70 in those communities as well. That's our phase 1 encompassment. But I would say that the long-term care residents most certainly are a priority in those communities and any long-term care home that has not had access to vaccines thus far. And we're hopeful that with the increasing number of vaccines in the weeks ahead, that we'll be able to do that as soon as possible. But do you have anything to add on the details, Doctor?
Yeah, no, I'll just say that initially the supplies were so tight that it is impossible to redistribute a few hundred doses coming every week or 2 weeks throughout the province, and I think that was the challenge. But with tens of thousands of doses hopefully coming on a weekly or bi-weekly basis, all parts of the province should be getting vaccine starting in the end of March.
I would just, maybe add one other piece is, some of our harder to reach areas in the province are in, the rural and remote north of Saskatchewan. And we did have a focus on that area in much due to the fact that we have some higher numbers with some fairly tragic outcomes proportionally throughout our rural and remote communities in the northern areas of the province. So we have provided some reasonable vaccine access to the northern parts of the province, which is harder to reach and will slow a vaccination program down to some degree. And we've done some of that area. And so when we do receive these larger numbers of vaccine, I'm very confident that we will be able to hit the vaccination numbers that I had put out here today, 4,000, should we receive them by the middle of March, 7,000, should we receive those vaccines from the federal government by the middle of April.
We'll take our next question in the room. Lynn?
Jumping back to healthcare workers. In the middle of January, the SAG did a presentation to the physicians, and it had like a very detailed breakdown of healthcare workers and when everyone would get vaccinated and where they all fit. Like, what changed between then and now that you were like, okay, no, those people don't need to be priority anymore?
Yeah, so I think basically there's no vaccine, hardly any vaccine available. And like the Premier said, we absolutely need to get long-term care residents, personal care residents throughout the province vaccinated, 2 doses. And then, the COVID-facing healthcare workers, the few thousand who already started getting vaccinated in mid-December, those will continue. It's a few thousand healthcare workers, under 10,000. The total number may be the total number of people who provide clinical care may be in the 30 to 40,000 range. But those under 10,000 COVID-facing healthcare workers started getting vaccines early in Regina and Saskatoon as part of the pilot. At that time, you couldn't move the vaccine even yards away from the ultra-low temperature freezer, as the logistics of transportation of vaccine were worked out very quickly. The far north with Moderna started getting vaccine at a community level, and very quickly Pfizer was moved to provide vaccinations to long-term care settings in areas where the Pfizer vaccine is going, including vaccinating COVID-facing healthcare workers in those parts of the province where the vaccine arrived. So that will continue. The priority healthcare workers, as advised by NACI for the first quarter, will continue to get vaccine throughout the province once the vaccine comes. But then, the NACI framework does include all healthcare workers in the second and third quarter. But again, it would depend on vaccine supply. And we're not unique in Saskatchewan. All provinces are facing this challenge that, all clinical-facing healthcare workers ultimately should be offered the vaccine. But till such time, we all have to use personal protection equipment very effectively. And then, of course, once we have completed 16 older and vaccine is available for 15 older, and then for the broader population, it is obviously very important that essential workers who are at high risk of exposure also get included, either as part of the age-based or as other opportunities arise. There may be additional vaccines that are approved, and the vaccine supply may increase through those mechanisms as well. So I think all those options we need to constantly look at. But right now, many thousands of healthcare workers who are COVID-facing have been vaccinated as part of the first sequence. But we absolutely need to make sure that long-term care residents, personal care home residents are also vaccinated, 80 plus. And as vaccine supplies come, 70 plus starts very quickly as well.
I would just add, a few items to Dr. Shahab's comments. Is first, many healthcare workers have been a priority in phase 1. In fact, as I said, the very first two people vaccinated in the province were healthcare workers right here in Regina. Second is the challenging vaccine supply that we have in the province. We're only 10, 12% of our way through phase one. This is very, very challenging to disperse what is a very scarce resource. And we have a number of people that want to have access to that resource. We heard from the mayor of Swift Current, and I understand why. We're hearing from a number of healthcare workers, and I understand why. And we're hearing from our educators, and we're hearing from representatives of our frontline law enforcement officials, and I understand why we're hearing from these folks. And I am familiar with the document that was circulated, and I trust that the Ministry of Health will be having a look at some of the recommendations that were in that document with an eye as to should some of those be pulled forward out of actually what was then, I believe, a phase two into phase one, and we'll await the Ministry of Health's advice on that on what their assessments are. But the fact of the matter is that not all healthcare workers in our public healthcare system are going to have priority access to this vaccine. I understand why the request is there, and Dr. Shahab had spoken to the risk of exposure earlier. There is a risk of exposure that varies across our healthcare system. That's one of the factors that needs to be taken into account. There also is the risk of a negative outcome when you do contract COVID-19, and that is age. Yes, some small groups that have some ailments, but predominantly age, and Dr. Shahab had the charts here that show that. And we need to balance that risk of exposure with the risk of a negative outcome with the capacity of us being able to deliver the numbers of vaccines that we are expecting to receive from the federal government. And we're trying to do that as best we can and to keep people safe and to ensure that we are, as quickly as possible, yes, making the vaccine available, but making it available to people that could have a very negative outcome, and also then balancing that with the integrity of our healthcare system.
Follow-up?
Dr. Shahab, you mentioned NACI, but NACI seems to recommend that all healthcare workers be prioritized ahead of the general population. So, how are you prioritizing speed over some of these priority populations, and what goes into that decision?
No, if you look at the NACI document in detail, and they will be updating their recommendations as we move forward, they provide a framework where they say that, like the Premier said, we have to recognize the importance of all members of society who have kept society running. So that is a broad statement that we have to absolutely recognize. But when you have severe constraints on supply, a lot of the NACI documents, really envisage broad supply right from the upfront, and then even if you had big, a large supply upfront, you still have to decide how to vaccinate. So NACI always says, people at highest risk of severe outcomes is always the priority from a clinical perspective. But then, of course, healthcare workers who have been providing care is a second broad priority group. And then essential workers who have been working throughout, keeping our power plants running, our transport running, grocery, retail, law enforcement, first responders, are absolutely priority. But if you have a severely constrained supply, which we have had for the last 2 months, where do you start? And that's why you have to really go into, for example, you have to look at the epidemiology of the virus. So it was absolutely 80 plus, and all of us have seen the devastation in long-term care homes and personal care homes. So it's residents of those facilities. And there absolutely, staff have been also vaccinated in those facilities because they are at risk of, inadvertently bringing COVID into those facilities. So staff in long-term care facilities, personal care homes, along with residents have been offered vaccination. Healthcare workers who have been working for the last year in ICUs, ERs, testing centers with proper PPE, but still at risk, at some risk to themselves, have been offered vaccination. So healthcare workers are being vaccinated as we speak. But it is unfortunately right now the supply only allows for maybe 10, 15, 20% of healthcare workers to be accommodated in these specific high-risk areas. But then as the supplies pick up, like the Premier said, we'll continue to look at opportunities to include healthcare workers who may be working in other clinical areas at lower risk of exposure, who can mitigate the risk through PPE, but certainly their risk is certainly higher than that of the general population. So that will have to be accommodated, either also linked with an age-based criteria or other criteria as supplies allow. And again, essential workers, I think all the requests we received are valid and they're aligned with the NACI framework, but our limitation is the severe limitation on supply.
On that, Dr. Shahab, if you go to your third last slide, the one with this assumption on it with the 300 doses per 100,000 per day starting January the 1st. And I think it just symbolizes the challenge that we're up against in receiving the bulk of our Q1 delivery in the last 2 weeks of Q1, as opposed to having it spread out over the entirety of Q1. 300 doses per 100,000 people per day starting January 1st in Saskatchewan would be about 3,500 doses per day. We just haven't been anywhere near that type of a delivery schedule. We will be by the middle of March, and then in a very short order, within 2, 3, 4 weeks, we are prepared to ramp that up likely to about 7,000 doses a day. So the delivery schedule of receiving 6 million doses in Q1 is fine. The delivery schedule of when you receive quite likely over 3 million of those doses in the last 2 weeks of March makes it very, very challenging, and it changes how you're going to make those doses available to Saskatchewan people as quickly as you possibly can. And so what we've tried to do with this vaccination schedule as we exit our phase 1, which will be sometime from today, is to balance, as I said, that risk of people not only in our healthcare system, but there's others that have a high risk of exposure as well with the negative outcomes, and ensuring that we have the capacity available to deliver as many vaccines as possible. We do not want vaccines being delivered to Saskatchewan and sitting on the shelf for 2, 3, 4 weeks before we're able to provide them to Saskatchewan people. We want to have those out and in people's arms as quickly as we possibly can, and that is paramount, I think, in us ensuring that we can achieve some of the modeling numbers that Dr. Shahab has here, as we have some challenges ahead. We have a number of variants that are now present in the world and in Canada, and even one of them now that is present in Saskatchewan. And so we are in a little bit of a race against time to some degree, and we want to make sure that as we receive those vaccines, that we're making them available to Saskatchewan people as quickly as we possibly can. And we want to reduce our hospitalizations, our deaths, those negative outcomes that we have. That is our priority. But we do need to balance that with the integrity of our healthcare system, and that's why we're going back in. We've asked the Ministry of Health to reevaluate the sectors that are being looked at a phase 1 delivery as of now, understanding we still have about 88 to 90% of phase 1 to find our way through before we even get to phase 2.
Sorry, I know I'm butting in here, but is that a risk of not having enough capacity to get vaccines out if we don't do by age? Are we just not going to move fast enough otherwise?
Well, you can maybe speak to the details of that, Doctor.
So, I'm sorry, could you just repeat the question again?
It's about capacity.
Yeah, he mentioned timing for, we want to get these vaccines out as quickly as possible, and with more coming, is that a risk that if we don't do by age, it'll be too slow?
Do you have a number of small segments?
So I think the way the Minister Merriman announced and Scott Livingston on Tuesday is that if you have broad categories which are easy to identify, that's how you can quickly do mass clinics, because it's not so complex that are you in, are you out. You don't want people going up and then being told, no, you don't meet this criteria, this complex list of criteria. So once you have enough vaccine, the easiest way to sequence is by age. And that also makes sense if age is the biggest determination of severe outcomes. Obviously, underlying risk factors also have a role, but everything said and done, age still is the biggest risk factor. If you have limited supply, it makes sense to do 80 and over and long-term care, and then 70 and over and 60 and over. And this is the conclusion that we have reached. This is a conclusion from NACI. They've done reviews on risk profiles, and everyone agrees, as well as my colleagues in other provinces, that age is the primary determinant. So especially initially when you have limited vaccine supply, you go with the highest risk like long-term care and as well as COVID-facing healthcare workers. We have to recognize that healthcare workers have been addressed right at the beginning, but as supplies pick up, the easiest way to move quickly through is through an age-based criteria, because then it's easy for everyone to understand you're eligible based on your age, and that gets the clinics flowing at a high volume. And then that hopefully will have an immediate impact on hospitalizations and ICU admissions, because if the highest proportion of hospitalizations, ICU admissions, and deaths are determined by age, the earlier you get 70 and over vaccinated and 60 and over vaccinated, the quicker you'll see a decrease in these unfortunate severe outcomes.
We'll take our final question on the line, operator.
We have Brian Zinchuk with Glacier Media.
Hi there. Looking at the coronavirus dashboard that Johns Hopkins University has been running, is that almost every nation that's had more cases than Canada, and Canada inclusive, is on the backside of a second or third wave. We've almost universities around the world have seen dramatic declines in infection rates. How does this play for Saskatchewan, Dr. Shahab?
Yeah, so we have known for a long time, even before the COVID pandemic came, that pandemics come in waves, and they can be 1, 2, 3, 4 waves. And second, we also know that respiratory viruses like coronaviruses do have a seasonality. They're more likely to have a stronger wave in winter months. So, and that's what we've seen. But the way viruses behave is that they go up, and we have to work very hard to make that peak as low as possible through public health measures, other interventions, and then the wave recedes. Like you mentioned, it's receding in many parts of the world. But we have to make sure that whenever the wave comes, it causes the least damage that we can incur. And unfortunately, throughout Canada and the northern hemisphere, and the fall wave has had devastating consequences for many jurisdictions. But like you said, hopefully we are on the downswing. But we can't let a guard down, because we still have more than 95% of the population not immune. We've already seen in the UK they had a severe second wave. We didn't have a severe first wave. We had a very small first wave, mostly linked to international travel. Had a quiet summer. Many parts of the world had a devastating first wave, including the UK, parts of the US. Parts of the US never went down. They had sustained transmission throughout the summer, which we didn't have. The UK had a devastating second wave, and then as they were coming out of it through a severe lockdown, they had the variant strain pick up, and they had a devastating third wave, which was even worse than their second wave. So I think we have been very fortunate. We have done well, but we really can't let our guard down, and we really have to stay the course with our public health measures well into our vaccine program till we have a large proportion of the population vaccinated. We really have to stay the course with the public health measures.
Follow up, Brian?
Yeah, for the Premier, I don't really know how to ask this, but a lot of the questions today about who gets it first, is it this group or is it that group? Well, we want it because we're in the face of it. They really seem to be questions that are fundamentally all the same. It's like Sophie's Choice, or perhaps that of King Solomon and the baby. How hard is it to make these decisions, and what do you draw on for, I guess, for your soul in making these decisions of how do you do this?
Well, when you draw on what you feel is best for the people of the province, and then you draw on the advice that is nearest to you. And I think we have been served in this province over the past 11 months with some very good advice by our Chief Medical Health Officer, Dr. Shahab. And, I just once again would like to thank him for his, never-ending effort. The man works 6-7 days a week, each and every week. He does so in a very unselfish manner, a very polite manner, and a very respectful manner as he approaches anybody that he does on a day-to-day basis. And he has provided this province with very sound advice for 11 months, and there is very little that occurs in the way of any decision-making or any conversation when it comes to COVID-19 in this province without some questions going to Dr. Shahab and looking to his advice with and thankful for the advice that he has provided. So I just would maybe close with that is thank you, Dr. Shahab, for your service to this province the past year. It's appreciated by myself, and I think it's appreciated by the vast majority, if not everyone that lives here.
That concludes today's update. Thank you for joining us.